Welcome to the Alex. We are excited that you have joined the Alex family. This overview will give you a sense of the scope of programs we offer and the values that drive the work we do. The Alex has been serving vulnerable Calgarians since 1973. Our first home was a small heritage building in Inglewood called the Alexandra Centre. We quickly outgrew that space, but took the name with us as we expanded to new locations. What began as a small Alex Community Health Center has now grown to a multi-service organization, the Alex. With a staff of almost 300, we are all working to provide innovative wraparound care for those who need it most. When we use the word vulnerable, it's the understanding that any of us could be in the position of vulnerability due to job loss, family dynamics, mental health concerns, or other factors. It's not a statement of the person, but of the situation. What we see on a daily basis at the Alex are community members who are resilient and dedicated to overcoming whatever obstacles they are facing, who just need extra support because of the complexity or interconnectedness of their current situations. You may wonder why we need a community health center in a country where universal health care and walk-in clinics are in every neighborhood. The most simple answer to this is trauma. Most of the people who walk through our doors have experienced trauma, either through living in poverty, experiencing homelessness, through mental health, or addiction. And for those community members, the model of seeing a doctor for 10 minutes for one issue simply doesn't work. We have seen that people who need the most help, those complex, interrelated struggles, are falling through the cracks. Complex health and social concerns require a different, more comprehensive model of care. That's why we offer a wide variety of health, wellness, and social programs, all under one roof. We recognize how difficult it is to ask for and receive help, how challenging it can be to make the time to miss work, find childcare, or even come up with transit fare to get to an appointment. Because of this, we ensure our team is able to spend as much time as required to best understand what people need to walk with them on their journey to wellness. Everything we do is informed by the idea that by improving physical and mental health, managing addiction, improving financial and housing stability, and increasing social supports, people will be able to have better social inclusion in their community and an increased quality of life. All of our programs also include a robust research component to ensure that we are using evidence-based approaches to truly move the needle on the issues that matter most to our community. Our community and senior health centers serve low-income Calgarians with complex health issues. Because our doctors are working on a salary model, they can spend extra time with each patient. Many people may come for a medical concern, but after a brief visit with the doctor, we learn that there are other concerns, like feeling isolated, being worried about finances, being food insecure, or at risk of homelessness. Because our medical programs also include wraparound social supports, we can then refer people to other Alex programs and work as a team to make needed changes. All of our programs are looked at through the trauma-informed lens, which in its simplest form asks, what happened to you, instead of what's wrong with you. Because we provide a welcoming, judgment-free environment, we're able to deliver preventative care for people who may otherwise wait until they're in crisis to seek help. By getting ahead of the problem and supporting people before they are in crisis, we are reducing emergency system use and creating medical homes for those who need them most. Our mobile health services are a great example of the Alex's ability to be responsive and innovative, filling gaps in our community support systems. In 2001, we rolled out the Community Health Bus, a fully functioning doctor's office on wheels. In partnership with other agencies, the bus rolls up and opens its doors to provide preventative health care and connection to those experiencing homelessness. It also works as a bridge to more permanent supports at our community health center. With a doctor, nurse, and resource specialist on board, the bus is able to provide a full range of services, including lab work and providing non-opioid prescription drugs, like insulin for street-connected Calgarians without a family doctor. At the Alex Youth Health Center, we see youths between the age of 12 to 24, knowing that 18 is not the magic age of adulthood. We extend our supports knowing that the brain isn't finished developing until the age of 25. And the late teens and early 20s are imperative years to develop resilience, coping strategies, and self-confidence. Like all Alex programs, we combine medical and social supports at the Youth Health Center, with a large portion of our youth accessing our drop-in social space for a hot meal and a welcoming smile from our staff. Over 50% of our youth are street connected, meaning that they are either experiencing homelessness or at risk of being housing insecure. We work with youth on job training, justice diversion, and life skills training, providing a safe space to be themselves. Our Youth Health Center also has a growing LGBTQ2S+ community, and we are one of very few health organizations who provide focused health care for trans youth. Being able to see a doctor who respects your gender identity is key to maintaining positive health connections. We also see lots of young moms and dads and have a pre- and postnatal program, as well as parenting classes to ensure that young families are set up for success. The Youth Health Bus was the second to join the mobile fleet in 2012 as a unique partnership between the Alex and the Calgary Board of Education. The bus visits in-need high schools on a weekly basis throughout the school year. Students can make an appointment through their guidance office and are not marked absent from class and do not need a note from their parents. Similar to the Community Health Bus, the Youth Bus includes a doctor, nurse, and resource specialist. Of course, sexual health is a big part of teen health concerns, but we also help students with mental health needs, coping strategies, and as a bridge to helping them have conversations with their parents on issues that matter to them. For many students, the bus is a safe space. Some visit simply to eat their lunch. What we hear from these teens is, if not for the Alex Health Bus, they would not be seeking help for their issues anywhere else. The most recent addition to our mobile fleet is the Dental Health Bus. The bus began as another gap filler, recognizing that dental hygiene education was needed in elementary schools to encourage healthy dental habits. The bus, outfitted with 2 dental chairs, sterilization, and x-ray equipment, could also be used to provide sealant and fluoride treatments, as well as dental cleanings for Alex clients. We developed partnership with Calgary Public and Catholic school systems, identified in-need schools, and set out to teach grade 2 and 6 students good oral hygiene. Then we met the kids. We were astounded at the decay rates we were seeing in almost 50% of the young mouths. Why were Calgary kids suffering from these levels of decay? We determined that we were seeing the children of the working poor, families who didn't qualify for benefits, often by only a small margin, who were also uninsured or underinsured by their employers. These families are paying out of pocket in the most expensive province in Canada. We quickly realized we needed to address these issues and began partnering with local dentist offices that volunteered to open their doors or come on our bus to provide extractions and restorative work at no cost to the parents. The bus continues to see students across the city with a wait list of almost 200 kids at any time. The need for low or no-cost dental care for our vulnerable communities is ongoing. The Alex was the first organization to join Calgary's plan to end homelessness, bringing our Pathways to Housing program and the idea of housing first to address the needs of those experiencing chronic homelessness. Housing First understands that you can't work on the issues that have contributed to homelessness while you are homeless. You can't work on addiction while sleeping on a park bench. And you can't work on trauma when you don't have a safe space to live. At the Alex, we provide a house first and then bring a full team of doctors, psychiatrists, case managers, social workers, and resources to the table. Working with people where they are at and supporting their journey to independence helps build resilience and better chances of lasting success. With 4 housing programs, 2 that have people living in their own apartments, and 2 that provide supported housing with 24-hour care, the Alex is using an evidence-based, dignified approach to working on the underlying causes of homelessness and supporting Calgarians towards brighter futures. The Alex Community Food Centre is one of our newest programs. Opened in 2016, the CFC is part of a national movement towards addressing food security through community action. The Alex was chosen by Community Food Centres Canada to open the first CFC in Western Canada. Since then, we have served tens of thousands of meals and created a bright and welcoming space where people can grow, cook, share, and advocate for good food. We envision a Canada where everyone has the means and knowledge necessary to access healthy food in a dignified way, and the ability and opportunity to be heard on the food issues that affect them. We envision a robust, diverse food economy that sustains farmers and the land, and a social consensus that good food is a key contributor to good health. By serving delicious, farm-to-table community meals, providing cooking and nutrition classes, and supporting peer advocates, the Alex Community Food Centre has energized the Greater Forest Lawn neighborhood through the power of good food. As the Alex moves closer to its 50th anniversary, there are a lot of exciting new programs being developed. In response to the Truth and Reconciliation calls to action, we are making purposeful strides in providing culturally reflective spaces for Indigenous community members to participate in Indigenous ways of knowing and healing. Our Indigenous Welcome Center, which will be formally named at a later date, will be a place for ceremony, smudging, and visits with elders. We are enhancing our social and wellness programs through several integrated programs, including a strong network of peer support and social workers who will help address immediate social needs. In the near future, our physicians will be social prescribing for in-house, barrier-free activities and programs at no cost. The increased focus on social programming supports will allow our physicians to use their appointments more effectively and will provide more entry points for our community to get the resources they deserve. We welcome you to connect with us on social media to stay informed about activities and events happening at the Alex. We also share tons of resources and articles on topics like basic income, trauma-informed care, addiction, loneliness, and other topics that inform the work we do at the Alex. Follow, like, and share to help us broadcast kindness into our community. Building community, treating people with dignity, and supporting their paths to wellness. These are all the fundamental values of the Alex. Thank you for being part of it.